This is Deborah from Sponaugle Wellness, and I'm here with Lori as she's getting ready to leave Sponaugle Wellness. And Lori, can you introduce yourself and explain your diagnosis, what it was here at Sponaugle Wellness?
Absolutely. My name's Lori. I'm from Pennsylvania, and I entered Sponaugle Wellness on May 8th, and I had a diagnosis of Lyme disease, babesiosis, Bartonella, gut toxicity, mold toxicity, and industrial toxins. After I started the program here, I then, about 6 weeks into it, was diagnosed with brucellosis, which is a very rare bacteria in North America, and I'll explain why, as well as a number of different pneumonias that are come through on the infectious disease panel.
And what would you like people struggling with your chronic illnesses to know?
There's hope. I mean, that's the best way I can say it, is there's hope. I am 30 years into my struggle of being sick, and at the point of going back 30 years, I had no idea what was wrong with me. Doctor after doctor, I've probably gone to 30 plus doctors in various areas, and the biggest thing was, it's in my mind. There's nothing wrong with you. You're okay. That didn't set well with me because something was missing. I knew there was something wrong. And let me just read you some of the symptoms that I had from the last 30 years, which were relatively consistent, and some worse than others. But just to give everyone an idea, I was angry. I had flares of anger that were horrible. I had brain fog, joint pain, POTS. I would stand up, get very, very, very dizzy, and have to sit back down. I couldn't breathe. I was breath starved. I was depressed. I was anxious. I had headaches. I had light sensitivity. I couldn't open my eyes. My eyes would twitch constantly on the right side. I had Bell's palsy twice in the last 20 years. Constant constipation. Constant. I had what now I realize is poor kidney filtration. I had a fatty liver that was enlarged. I had high liver enzymes. I had T foci that were flares in my MRI. That were said to be because of my age, not necessarily anything else. I had racing heart, I had palpitations, I had insomnia, I had burning in my bottoms of my feet that were horrible, plantar fasciitis type of pain, I had leg tingling, I had leg pain, I had UTI-like feelings every quarter. I think I have a bladder or UTI infection, and it was coming up negative. I gained weight without eating. I would eat the smallest number of things and I would gain weight. I wrestled with weight gain my entire life. I had high parasitic activity my whole life. I was diagnosed with COPD. I had difficulty driving. I would actually see car headlights in the other lanes coming directly at my car. It was very distorted. I had gallbladder problems, extraction issues. I had high cholesterol. I had different blood serum issues that nobody could explain, and they just said, it's you. So I guess the key thing is that those things are not in my head. Those things are things that are bodily functions. Okay. So after all those symptoms and being told it's in my head, I somewhat knew that wasn't the case. So I spent 20 to 30 years attempting to do holistic things, everything from chiropractic to acupuncture to detoxing foot baths to steam baths to hot saunas, a little bit of everything, massages, etc. And I actually was able to remain functioning for those 30 years, not at a great level because I always had these symptoms, but at least I was able to get through, and I was a functioning human being. I was working, I was taking care of things, and I had my life together until 2016, when my life sort of fell apart. And that falling apart was very simple. I came home from a business trip one day, and I couldn't breathe. And I was rushed to the emergency room, and the emergency doctor told me it was stress, and I needed to quit my job, and I needed to decompress and eat better. If someone else told me I needed to eat better, it was just the last straw per se. And I remember leaving the hospital a very angry person, but I was also slowly deteriorating. I was unable to talk. I had a stroke-like type talk. I couldn't walk straight. I really couldn't stand up. I couldn't go very far. I couldn't do very many things. So that transpired, and with the help of my sister-in-law, I did actually get to an initial doctor for Lyme disease. That did help me in the beginning, but I wasn't getting better. I was getting worse, actually. My body was breaking down a little bit further because it was antibiotics on antibiotics. So my Lyme disease, per se, pieces of it might have gotten better, but my body started to get worse. So at that point, I knew I needed to do something different. So I found Dr. Sponaugle.
What did you find was the main difference in your treatment with Dr. Sponaugle versus other doctors?
Data. Data. I'm a research person in my job, and the fact that somebody could tell me with data points that this is what's wrong with me was the most exceptional thing I had ever had. He does PET scans. He does urinalysis that shows your amino acids. He does your brain chemistry. Imagine being told it's in your brain the whole time and nobody ever tested my brain chemistry. My brain chemistry was terrible. You know, we do blood tests. You see parasitic activity. You see your blood, and you see whether you have you know, mold and different things. So basically, Dr. Sponaugle sat down there for 3 hours with me and told me what was wrong with me, and it was the biggest relief I think I could possibly tell you. I didn't know what to do. I cried, and I thanked him, and I said, "I'm ready. Let's go." And he said, "I like that." He goes, "That's what you need to do. You know, be positive, because it's not easy." But what I ended up having, in addition to, you know, what I told you in the beginning, is that when you do all these tests that he's done, you have DNA methylation that he does, which shows you whether your body can detox. Detox is a critical component of something that I don't think many people understand. When you're killing things in your body, when you're taking antibiotics and you're not detoxing properly, nothing's going anywhere. So it's sitting in your body. So, you know, with the DNA methylation, you know, my body struggles to detox to begin with. So they know that, and they you know, you're told what to do. You have colonics and foot baths, and you have different methods of detoxing, beamers, that are going to help you in conjunction with your treatment. Then the other thing, which was huge for me, was that I have a gene and what's called a halotype at HLA-DR, which I'm mold susceptible and Lyme susceptible. So, and the way that works is that when you have those, you basically can't get rid of them in your body easily. So not only can I get rid of it because I have methylation and this issue and that issue, I don't want to go into all the medical terms because Dr. Sponaugle has a ton of things on his website, but the bottom line is my body was shut down. My immune system was shut down in my 20s. So I have done everything I can from that period of time to try to get over. But this learning, this information, this ability to understand what's wrong was the first step. Then, you know, again, the next step is you start being treated and you watch yourself get better. You get worse first, because that's the way it works. You have to get worse to get better, worse to get better. But the primary thing he does is he builds up your immune system. So your body begins, my immune system when I came in was negligible. It was not working. And it probably hasn't been working for years. So the first thing he does is build it up. So I felt better. I was like, wow, I feel better. And then he laughed at me and said, well, now I'm going to take you down, because now I'm going to get all the things that are out in your body. And I didn't understand what that meant until we went through biofilm. Biofilm is this thing that takes all of your bacteria and all of viruses and a lot of things, and it hides them, you know. So all throughout your life, as my immune system hasn't been working, I've collected all of this bacteria and virus and everything in my biofilm, and it's just been floating around my body. And when I'm coming for treatment, I'm finding that, you know, mold is coming out, and industrial toxins from when I used to buy plastics packaging in my 30s is coming out. And these you know, off the chart type scale numbers of things that are happening, I can see every week, week on week on week. I can see when I know when I'm feeling well now. So now I can look at my test results and say to my nurse, I felt good that day, that should be good. And she says, yep, you did. Or I felt bad that day, these are going to be bad, and yep, they are. So now I have this learning over this, you know, 4-month period of time where not only have I watched my body get better, but I've actually come to understand it more, and I actually know what to do now when I feel certain things. So the education, which is really the third thing, so you have the data, and then you have watching it through your 4-month period of time of getting better. I now have this education. I now go home and say, I know exactly what I need to do, and I know how to describe it, and I know what I need to do to be healthy in my future. And that is a massive, massive benefit that I was never able to get from anyone other than eat better, it's all in your head, and just quit your job and be less stressed. And here I got everything, a big package of everything.
So now, Lori, that you are leaving, what will you change, continue, or do to take away from your treatment?
Well, I'm going to do a lot more than I used to do. So I'm probably going to detox my body more frequently than I had ever. Foot baths and infrared saunas and beamers, all these tools that are out there that allow and help your body, especially when it has a DNA mutation, to detox things in your body every day. But the most important thing is I got to keep my immune system healthy. So now I'm going to work on, and I have before going home, a protocol that I will use to keep my immune system healthy. And when I do get sick, I now need to be very careful about what I want to do and don't want to do. So careful about what I take and don't take, because the best thing for your immune system is to let it take care of itself. So I'll definitely improve my immune system and continue to watch over that really strictly in the future. The other thing that's really important is as I've researched all these things going over the last 4 months, I found that the chemicals and some of the things that were coming out of my body are actually in my water. They're in my public water in my home. So I had no idea until I got my first water report, and these are all things that they're available to us, but nobody ever really looks at them because they don't think it's an issue. But when you're sick and you don't have an immune system, these chemicals that they're treating the water with, as well as all the rest of the contaminants that are runoff and things that get into the public water, end up becoming problematic for you. So I have my entire home outfitted with water treatment systems to be able to remove those types of things and to give me the security that I'm actually bathing in appropriate water, because it's not the drinking water, it's the bathing water as well. And mold, I now know, because I'm mold susceptible, as I spoke, I'm mold and Lyme susceptible. I now know I will need to keep, watch on my air. I know where mold comes from now, behind the showers, and you don't smell it. But it's behind there if you have a leak in, the grout or anything like that. So I have air purification systems that I'll have in the homes as well. I'm going to change how I eat. Now I did change how I eat before, but I'm going to change it a little bit more because there are things that I've found now that I feel better. When I do eat them, I don't feel well at all. So that's even more reason for me. If I tried to eat something that wasn't good for me, it's going to come back, and I'm going to change my diet because of that. Doesn't mean I'm not going to have things. It doesn't mean I'm going to restrict myself from things. It just means that I'm going to be much more cautious of what I do. I'm going to meditate more. Mental health, now that I was told it was in my mind all the whole time, is as much as physical health. So meditating, being positive, all those outlooks on your life that are critical. I no longer see life through a sick lens, I guess is the best way to say it. So I feel like, although it might not be the right word, but I believe it's the right word. I feel like I've been transformed. So my lens is different physically as well as mentally. And from that, what I want to stop doing is anything that harms me, from a toxicity perspective. If I go into some place and I smell mold, I'm leaving. If I don't feel well at a place that I go to, I'm going to move. If I'm in a hotel and I don't feel well, I'm going to move. Those are not things I did before, and actually these are the areas that probably made me more sick in the end, because I didn't recognize the symptoms until after I was really sick. And then I find out, well, that's because I was in a moldy room. So those are the core things that I'm going to do, but I also think in general my goal at this point is to keep an awareness of how my body works. So I will tend to get more involved in understanding what I can continue to do for the benefit of me and for others in the future. So I want to thank Dr. Sponaugle for bringing my life back.
Thank you, Lori, for sharing your story. We're so happy for you that you're doing so well. You're getting to go home. We are going to miss you.
Thank you very much.
But we're happy. Thank you
very much.